Hello, it's September 24th, and I wanted to give everyone a quick update on the COVID situation. As you can see, we've had a significant decline in average daily cases and a decline in average daily hospitalizations. Sadly, however, we've lost 9,425 Mississippians from COVID, and again, sadly puts us #1 per capita in deaths for the country. If we look at our hospital utilization, we have 700 folks in the hospital with COVID and declining numbers for our ICU and life support patients. Again, sadly, though, many of these won't make it back home, so we'll anticipate seeing additional deaths in coming days. Our hospital ICU utilization is still very high at historically high levels. We have had a decline in COVID hospitalizations, but a rebound in non-COVID hospitalizations, again, leaving our healthcare system pretty well stretched in terms of ICU bed capacity. We're still under the statewide COVID system of care order, which is due to expire next Wednesday. And depending on conditions, we may need to renew it or we'll discontinue it. We do know that still the vast majority of cases are in unvaccinated folks, as are the vast majority of hospitalizations and deaths. We know that our breakthrough deaths are mostly older folks who have weakened immune systems, and we're excited to be having more availability of booster doses. We know that most of our breakthrough deaths are people 65 and older, and we have not had a single breakthrough death in anyone 40 or younger. And even in the 50 to 64-year-old, most folks are unvaccinated who have not made it, unfortunately. And even for high-risk groups like 65 to 74, there's a marked reduction in death for those who are vaccinated compared to those who are not vaccinated. We've had good progress, especially in our disparity work when it comes to African Americans. We know that our African American Mississippians are more vaccinated than their white counterparts, and our African American immunization rate is 33% higher than the national rate. If we look at Mississippians 65 and older, we can see that significantly more Black Mississippians are fully vaccinated compared to white Mississippians, and our highest vaccinated group is Asian Mississippians. Sadly, we have lost 15 pregnant women throughout the course of the pandemic, most of them having occurred during this Delta surge. CDC has now recommended booster shots for people 65 and older, also for people 50 to 64 with underlying medical conditions. Those 18 to 49 may consider receiving a booster dose at greater than 6 months. The people 18 to 64 who are high risk for COVID because of occupation may also consider a booster. This is only for Pfizer. Moderna and Johnson & Johnson have not been evaluated for boosters yet. Now keep in mind that immunocompromised people still will need a third dose of Pfizer or Moderna 4 weeks after the second dose. This is different than the routine boosters that have been recommended by CDC. In regard to monoclonal antibodies, we are seeing declining utilization of monoclonal antibodies. We had a peak of almost 10,000 doses per week. This has been a phenomenal success with almost 250 locations across the state of Mississippi where people have access to monoclonal antibody treatment. We have adequate supplies in the state of Mississippi and are still strongly encouraging doctors and clinics to use monoclonal antibodies for people who are diagnosed with COVID. That's all I have. Thank you for joining me.